No one tells you this about your body after menopause. You expect hot flashes, maybe some mood swings, but no one talks about how your most intimate health changes in ways that can feel confusing, uncomfortable, even isolating. This video is different. We're going to tell the truth, what's really happening, why it happens, and what you can do starting today. Because this isn't just about your body, it's about your comfort, your confidence, your relationships, and your health. Stay with us. What you learn in the next few minutes could change how you care for yourself forever. No one talks about it enough, but nearly every woman who goes through menopause experiences changes down there. And for many, these changes aren't just physical. They affect confidence, relationships, and overall well-being. But here's the thing. It's not your fault, and you're not alone. These changes are driven by biology, and once you understand what's happening in your body, you can start taking back control. Let's begin with the hormone at the center of it all, estrogen. Before menopause, estrogen plays a powerful role in maintaining vaginal health. It keeps the tissue thick, elastic, and well lubricated. It also helps maintain a healthy vaginal pH and supports the growth of good bacteria that protect against infections. In short, estrogen is the reason your vaginal tissue functions comfortably and efficiently for most of your adult life. But after menopause, typically around age 51 in the US, your body stops producing as much estrogen. This sudden drop causes a cascade of effects, especially in areas most sensitive to hormonal changes. The most common and noticeable change, vaginal dryness. This isn't just a slight shift. For many women, it feels like a dramatic transformation. The tissues become thinner, less elastic, and more fragile. The natural lubrication you once had is no longer reliable. And without that moisture, everyday things like walking, sitting, or wearing certain clothes can cause discomfort. Intercourse can become painful, sometimes unbearably so. Doctors call this condition genitourinary syndrome of menopause, or GSM. It's a term that encompasses a range of symptoms beyond dryness, including burning, irritation, itching, and even bleeding after sex. Many women also notice increased urinary urgency or frequency and a higher chance of developing urinary tract infections. These symptoms aren't in your head, and they're not just a nuisance. They're a real medical condition caused by a lack of estrogen, and they deserve real solutions. Another important change happens to the vaginal pH level. Before menopause, estrogen helps maintain an acidic environment, which protects against infections. But with less estrogen, the pH rises, making the area more alkaline. This change invites harmful bacteria, disrupts the vaginal microbiome, and increases the risk of infections like bacterial vaginosis or recurrent UTIs. On a microscopic level, the vaginal walls become thinner and more fragile. They lose collagen, blood flow decreases, and the tissue becomes more sensitive. Some women describe the sensation as feeling paper dry or burning, especially during or after intimacy. But perhaps one of the most overlooked aspects is how these changes impact your self-image. You might feel like your body is betraying you, or that aging is stealing parts of your identity. Many women report avoiding relationships or intimacy altogether, not because they've lost interest, but because they're afraid of the discomfort or embarrassment. Here's the truth. Vaginal changes after menopause are incredibly common, affecting over 50% of postmenopausal women, according to the North American Menopause Society. Yet fewer than 25% actually talk to their doctor about it. Why? Because society has told women for too long that this is just part of aging and something they must quietly endure. But you don't have to. Understanding that these changes are caused by a hormonal shift, not personal failure, is the first step. Once you're informed, you can make confident, empowered choices about how to care for your intimate health. And the good news, There are safe, proven treatments that can restore your comfort, improve your quality of life, and bring back the confidence you thought you'd lost. But before we get there, we need to talk about why so many women suffer in silence and what's really behind the shame and silence around this issue. For something that affects millions of women, vaginal health after menopause is still one of the most hushed topics in healthcare. And that silence? It's doing real harm. Think about it. When was the last time a doctor, any doctor, brought this up during a checkup without being asked? Most women say never. And unless you bring it up yourself, odds are it won't be discussed. But why? You see, truth is uncomfortable. There's a deep cultural stigma around aging and sexuality, especially when it comes to women. After menopause, society tends to treat women as if they've crossed some invisible line, like their intimate health, their pleasure, and even their discomfort no longer matter. That narrative is not only incredibly unfair, it's flat out dangerous. As a result, many women internalize the belief that their symptoms are just something they have to deal with. They blame themselves. They stay silent. They put off going to the doctor. They stop being intimate with their partner. And they begin to believe they're somehow less feminine, less desirable, or less worthy of care. It's heartbreaking and unnecessary. Let's be clear, postmenopausal vaginal changes are not just a cosmetic issue. They are a legitimate medical condition with real symptoms that deserve attention, compassion, and treatment. To understand how this silence hurts real people, let me tell you about Linda, a retired schoolteacher from Ohio. At 63, she started feeling constant vaginal dryness, itching, and pain during intimacy. She thought it was just part of aging. Her OB/GYN had never mentioned it. She assumed there was nothing she could do, so she stopped being intimate. She stopped wearing certain clothes. She avoided swimming and bike rides, and slowly she stopped talking about it, even with her husband of 30 years. It wasn't until Linda stumbled across a podcast episode about menopausal health that she realized what she was experiencing had a name. It was common. It was treatable. That revelation brought tears to her eyes. Linda's story isn't rare. It's the norm. And that's exactly why this conversation is so important. Here's another reason women stay quiet: fear of being dismissed. Many women report being told by doctors it's just aging, or it's normal, or worse, you should be grateful you're not dealing with worse. These kinds of responses make women feel invisible, and they discourage further discussion. But you deserve better. Your symptoms are real. Your comfort matters. And talking about it isn't oversharing, it's advocating for your health. At Second Sunrise, we believe no woman should suffer in silence, especially when solutions exist. That's why we're having this conversation today. It's not taboo, it's not shameful, it's just health. And understanding how much this silence costs, physically and emotionally, is what sets the stage for our next chapter. Because next, we're going to uncover the hidden health risks that often go untreated, and why ignoring the signs can lead to far more than just discomfort. It's easy to dismiss vaginal discomfort after menopause as just a normal part of aging. But ignoring these changes can lead to serious health consequences, many of which go undiagnosed for years. Let's start with a condition you may not have heard of, even if you're already living with it: vaginal atrophy, also known as atrophic vaginitis. This condition occurs when the vaginal walls become thin, dry, and inflamed due to low estrogen levels. Left untreated, it doesn't just stay uncomfortable, it can progress and lead to tearing, bleeding, and frequent infections. According to the Mayo Clinic, vaginal atrophy affects nearly half of all postmenopausal women, yet most suffer in silence or think it's something they just have to tolerate. But the consequences don't stop there. One of the most frustrating and often overlooked results of low estrogen is the increased risk of urinary tract infections, UTIs. When estrogen declines, the protective vaginal flora, the good bacteria, also diminish. This shift in the microbiome allows harmful bacteria to thrive, making recurrent UTIs more likely and more difficult to treat. Women often report a constant urge to urinate, burning sensations, or even urinary incontinence, none of which are just aging. These are treatable symptoms linked directly to estrogen deficiency and tissue changes. Yet many women go undiagnosed or are treated with antibiotics repeatedly, never addressing the root cause. Another lesser-known but deeply impactful condition is lichen sclerosis, a chronic skin disorder that causes thin white patches in the genital area. It can be extremely painful and, if left untreated, may even increase the risk of vulvar cancer. While it's not caused solely by menopause, its onset often coincides with the hormonal changes of this life stage. And let's not forget the emotional toll of untreated symptoms, chronic discomfort, pain during intimacy, fear of accidents or odor, and shame over changes in appearance. These stressors can contribute to anxiety, depression, and isolation. Some women stop socializing, exercising, or even leaving the house, not because they're old or fragile, but because they feel out of control of their own bodies. And yet, none of this is inevitable. The problem isn't menopause, it's not being informed or prepared for what menopause can bring. When these symptoms are left to fester in silence, women suffer longer and more severely than they need to. Here's what makes this even more frustrating. Almost all of these conditions are highly treatable, but they have to be diagnosed first. And for that to happen, women need to speak up, and providers need to listen. So, if any of these signs sound familiar, don't wait. This isn't just about comfort. It's about health, quality of life, and protecting your body from preventable complications. And now that you understand the risks, it's time to talk solutions. Yes, there are safe, proven treatments that work. And the sooner you know your options, the sooner you can start feeling like yourself again. Let's begin with what many doctors consider the gold standard for treating vaginal atrophy and dryness: topical estrogen therapy. Unlike full-body hormone replacement therapy, which affects your entire system, topical estrogen is applied directly to the vaginal area. It comes in several forms: creams, tablets, suppositories, and vaginal rings. These low-dose treatments help rebuild the tissue, restore moisture, and relieve discomfort. According to the North American Menopause Society, these local estrogen therapies carry minimal risk and are considered safe for long-term use, especially in women who do not have a history of breast cancer. What makes topical estrogen especially effective is its ability to reverse many of the changes we covered earlier. It improves blood flow, thickens the vaginal lining, restores elasticity, and brings the pH back to a healthy level, helping reduce infections and irritation. But what if you can't or don't want to use hormones? That's where non-hormonal treatments come in. Today, there are excellent over-the-counter options that can offer real relief. First up, vaginal moisturizers. These are not the same as lubricants. Moisturizers are designed to be used regularly, even when you're not sexually active, to maintain hydration and improve tissue health over time. Look for products that are pH balanced and free from perfumes or irritants. Then there are personal lubricants, which are essential for comfort during intimacy. Water-based lubricants are generally safe and effective, but silicone-based options tend to last longer and require less frequent reapplication. Just be cautious with products that contain glycerin or parabens, as they can irritate sensitive tissues. Next, let's talk about something more advanced: vaginal laser therapy. This newer technology, like Mona Lisa Touch or CO2 Re-Intima, uses gentle laser energy to stimulate collagen production in the vaginal wall. The procedure is non-invasive, relatively painless, and done in an outpatient setting with no downtime. The goal is to rejuvenate the vaginal tissue, improve lubrication, and reduce symptoms like itching and pain. While results are promising, and many women report significant relief, it's important to know that these treatments are often not covered by insurance and can be expensive. Also, more long-term studies are needed to fully confirm their safety and efficacy. Still, for those who've tried everything else, laser therapy can be a game changer. What about lifestyle changes? Do they matter? Absolutely. Diet, hydration, and regular physical activity all support vaginal health. Staying hydrated helps maintain natural moisture, while omega-3 fatty acids found in fish, flax seeds, and walnuts have anti-inflammatory benefits that may improve tissue elasticity. Probiotics, whether in food or supplement form, support a balanced vaginal microbiome. Another powerful option is pelvic floor physical therapy. Many women experience not just dryness, but also pain, tightness, or a feeling of pressure. A licensed pelvic floor therapist can help with exercises and techniques to relax and strengthen these muscles, making intimacy more comfortable and improving. Bladder control. Let's not forget mental and emotional support. Feeling confident and informed is a crucial part of healing. Joining a menopause support group, talking to other women going through the same thing, or simply hearing that you're not alone, these things matter. And they help reduce the fear and shame that so often block women from seeking treatment in the first place. So how do you get started? Here's what to ask your doctor. Could my symptoms be related to low estrogen? What are the pros and cons of topical estrogen therapy for me? Can you recommend any non-hormonal options? Is vaginal laser therapy available or appropriate for my case? Would pelvic floor therapy help me? And don't be afraid to bring notes or speak openly. If your doctor brushes it off or dismisses your concerns, find another provider. You deserve someone who takes this seriously. Too many women suffer in silence, not because there aren't solutions, but because no one told them what's available. You now know more than many women your age, and more than some doctors may offer during a rushed appointment. But the truth is, knowledge is only the first step. Acting on it is what changes lives. And if you've made it this far, it means you care about your health and your future. So if you're finding this video helpful, give it a like and subscribe to Second Sunrise. We're here to help you navigate these changes with clarity, dignity, and confidence. Up next, we'll talk about something just as important: how to start the conversation, because even the best treatments won't help if we're too afraid or too ashamed to talk about what's really going on. You now know the facts. You know what's happening and that there are real, effective solutions. But here's a truth that's just as important. None of it matters if you're too ashamed or too afraid to talk about it. This is the part where many women get stuck. Not because they don't want help, but because starting the conversation feels impossible. Maybe you've gone years, decades even, without talking about this part of your body. Maybe it was never something you were encouraged to speak about growing up, or maybe you were taught that silence is strength and that pain is just part of womanhood, but it's not. Silence is suffering, and suffering alone is not noble. It's unnecessary. Let's start with the most important place to speak up: your doctor's office. If your healthcare provider hasn't brought up vaginal or urinary health after menopause, bring it up yourself. You are not being dramatic or high maintenance, you're being proactive. And here's the key: be direct, clear, and honest. You don't have to use medical jargon, you just have to describe what you're feeling. You don't have to say it perfectly, you just have to say it. You don't have to use medical jargon. You just have to describe what you're feeling. Here are a few ways to begin. I've been experiencing dryness and discomfort. Could this be related to menopause? Sex has become painful since I stopped menstruating. What are my options? I feel like my vaginal health has changed, and I want to understand why. I've been avoiding intimacy because it hurts. I want to feel like myself again. If your doctor brushes it off or tells you it's just part of aging, you have every right to find another provider. You deserve a doctor who listens, respects your concerns, and offers science-based solutions. For women with partners, changes in vaginal health can put a strain on intimacy. You might feel embarrassed, anxious, or fearful of rejection. You might start avoiding sex altogether, not because you've lost interest, but because it's become uncomfortable or painful. Here's what many women don't realize. Your partner may already know something's changed, but doesn't know why or how to bring it up. Opening up might feel terrifying, but it can also be deeply healing. Try starting with vulnerability. I've been struggling with some changes in my body, and I want to share them with you. This isn't easy to talk about, but I miss feeling close to you. I want us to be intimate again, but I need your support while I take care of my health. Chances are your partner will respond with compassion, not judgment. And if they don't, that speaks volumes too. If you're not in a relationship or you're not ready to talk to your doctor yet, that's okay too. Start by talking to someone, anyone, who makes you feel safe. A trusted friend, a sister, a therapist, a support group. Even just watching this video means you've already taken the first step. Now let's clear up the questions that still hold many women back. Is pain during sex after 60 normal? No, it's common, but it's not normal. Painful intercourse is usually caused by vaginal dryness and thinning tissue due to lower estrogen. These symptoms are treatable. Is vaginal estrogen safe? For most women, yes. Low-dose vaginal estrogen is absorbed locally and minimally affects the rest of the body. According to the American College of Obstetricians and Gynecologists, it's considered safe for long-term use in most cases, even in some breast cancer survivors, with medical supervision. Can diet really help? Yes. Omega-3s, hydration, probiotics, and vitamin D can support tissue health, reduce inflammation, and balance vaginal flora. It won't replace treatment, but it will support your healing. Do I still need to treat vaginal health if I'm not sexually active? Absolutely. Vaginal health affects your comfort, your bladder function, your hygiene, and your sense of well-being. You matter, no matter your relationship status. Is it too late to treat symptoms if it's been years? Never. The tissue can still respond. Healing is possible at any age, so take the step. Don't wait for it to get worse. Don't settle for discomfort. Don't let silence make your decisions for you. You've made it to the end, and that means something. It means you're not just curious. You're ready. Ready to take back control, ready to feel like yourself again, and ready to stop accepting discomfort as the price of aging. Here's the truth. Menopause is not the end of anything. It's the beginning of a new chapter, one where you have more freedom, more clarity, and more power than ever before. Vaginal health after menopause isn't a luxury. It's not a bonus or something to be embarrassed about. It's part of your total well-being. Just like heart health, bone health, and mental health, it matters. And now you know what to do. Start the conversation, make the appointment, try the treatment, or maybe the first step is just acknowledging what you've been feeling and giving yourself permission to want more, because you deserve more. You deserve comfort. You deserve confidence. You deserve to feel at home in your body again. This isn't about turning back time. It's about honoring who you are right now, strong, wise, experienced, and still evolving. At Second Sunrise, we believe that health is power, and power comes from knowledge, action, and connection. So if this video helped you in any way, please like it, subscribe to Second Sunrise, and share it with a friend who might be suffering in silence. You never know who needs this message until it reaches them. And don't stop here. Check out our other videos that explore everything from hormone health to mobility, sleep, and emotional well-being. Because your second sunrise isn't just a moment, it's a movement. And it starts with you.